Aloha and good morning. It's so great to be here in beautiful Hawaii, leaving rainy Seattle, hailing Seattle, in fact. I'm a principal at Health Management Associates and a longtime board member of State of Reform from prior lives with other healthcare employers. I'm really honored to be here introducing our opening keynote speaker, Governor Josh Green. Josh is a father, a family man, a physician, an elected official many times over. Governor Green is also a notable healthcare champion. From mandating coverage through Luke's Law for autistic children to get healthcare coverage as a state senator and chair of the Health and Human Services Committee, to his successful efforts to curb and control the coronavirus, to his commitment to housing as healthcare, Governor Green has drawn the attention of the nation for his bold leadership and accomplishments. We are really thrilled to have him here this morning to share his outlook for healthcare priorities and for Hawaii for 2024. Please join me in welcoming Governor Green to the stage.
Aloha. So we're going to get a couple basic slides up, but first, before we even do that, let me just say mahalo to State of Reform. It has been a joy to be a part of this off again, on again, as one of your guests for many years now. I remember the first day that we came together when I was working with the Hawaii IPA, and this concept arose, I think more than a decade ago, that we began to bring all together the top minds in healthcare and industry and business in our state because there's such a need. We have always been known as the health state for many reasons, for reasons that speak to what one of my heroes, Jack Lewin, was doing back before I got into health policy. And so many giants led Hawaii forward over the many years to make Hawaii a special place, to ensure almost everyone to have access to health care where other states do not have access. So we've built on our values. Our values of aloha and ohana really permeate what we do in Hawaii on health care, amongst other things. And that's why we're an outlier. That's why we have the longest lifespan in our country here in Hawaii. It's not just because my Japanese in-laws will never die. It's because we actually provide health care to people in ways that other states have not decided that they should. But we still have challenges, as we all know, and we fight them every day and week and month and year here in our state. The healthcare disparities that exist for other parts of my family, on Jamie's side, where a lot of her relatives are Hawaiian, living on Big Island without access necessarily to certain services, and with challenges with poverty. Those disparities are profound, and they affect what we are and what we can do for the people we love. Irrespective of how much we lean into insurance or how much we lean into having primary care access, those are the challenges that constantly plague us. And so I'm very grateful to see this group come together and take on each year, year over year, these super challenges. So thank you. Thank you for sticking with us, and thank you for making it possible for us to take this to the next level, because that's my commitment. My commitment with our team, and I see many of them here in the front row and throughout the audience, our team now in the administration, which is the focus team, you are our broad team, we can go much further beyond anything that we even dreamed of in the past because of the foundation that we have. So let me just share a few thoughts. This has been an extraordinary year, and I'm honored to serve as governor. To be the only physician governor in the country means that I feel a sense of commitment to this issue, because what we do hopefully will be replicated in other parts of our country. But also, I think about every day, what we don't achieve should be held against us, and against me in particular, if we don't achieve in certain areas, because after all, we have lived and breathed healthcare for so long. So some of the challenges that I think we should talk about, and these are not new to us. I'm speaking more broadly about the healthcare professional shortage today, not just the physician shortage, which we often have characterized in our state, which is historically 600 or 700 physicians short, but the professional shortage. Because in spite of our ability to outdo other states, except for Vermont, which seems to be close to us, damn it, all the time, as achievement goes, we do have this shortage, and for years we've been waxing philosophic about how we might actually take that on, and I'm very happy to report we are crushing that now. We have 1.9 beds per 1,000 people in Hawaii. Sometimes we have enough beds, but we just can't find enough personnel because it is so difficult to afford Hawaii. In spite of an ability often to bring salaries to a good place, whether it's in physician quarters or nursing, and we all know it's up and down, and we all do our very best to make that work, we still struggle with the fact that we are so expensive. Housing is so darn expensive that recruiting professionals is an utter challenge, even though we are a great state to work in as healthcare leaders. So this affects our quality of care and our quality of life, because all too often, the days I was doing shifts, we were struggling to find enough nurses to cover the team, enough consultations and social workers to help make possible all the things we really wanted to do for our people. And that was because they couldn't afford to live here at the end of the day. And it's especially severe on the neighbor islands. We historically have had about a 20% shortage of healthcare professionals across the entire spectrum on Oahu, but about 40% on the neighbor islands. We have about a third of our population living on those neighbor islands, and so we leave a lot of people behind if we can't help them. Now, we have great providers at HHSC and in the clinics and the community health centers, but they can only do so much if they don't have enough support, and so that's what we've got to fight for. Now, there's been some infrastructure changes this year. A lot of what we've wrestled with is Hawaii has just not had enough investment in our necessary, secure healthcare structures. So I'm turning that on its head right away. Places that I did come from, there is always a bias. You go at the problems where you're most familiar with them. Kona and Hilo on the Big Island, they needed a lot more healthcare support. And I don't know if people are aware of this, because what I like to make sure people know is it's not just healthcare, it's social health. On the Big Island, as much as 50% of the population needs extra support, whether it's social services or Medicaid support. The numbers are really large. So if you don't have a true healthcare backbone at our facilities, you really run into big trouble. As extraordinary as the access can be in some towns, it is very thin when you get to places that I'm familiar with, like Ka'u, Kohala, Hawaii, of course, in other parts of the state that are quite rural, which is why we're investing in rural areas right now to not just make it better there, have better facilities that are modernized, but to entice providers to go there, to make it truly desirable to go and live on the neighbor islands where much of the most important healthcare access will occur, because they will capture people who haven't had access to care in a long time. They'll have delayed disease treatment. They will have less screening in many cases, and more advanced disease. I've shared the story once or twice before. One day I was in Ka'u in the clinic, and a woman came in, and she was orange, utterly orange, like this woman's shirt. Stand up there, so let me see if you don't mind. Thank you very much. You are fine. But she was orange, and she had not had a visit in years. It was the first visit for me with her. She had moved from Florida, and she was very clearly cachectic. She had had a cancer of some sort. And when I did a physical exam, I sent off blood work immediately. I could feel the tumors in her pelvis and abdomen. And upon really quick evaluation, even before CT scanning, she had full obstruction of both of her ureters and was in renal failure. And she had been given vitamin treatment for ovarian cancer, basically. And that was on the mainland. She had made a decision to seek natural treatments, and I respect anyone's decisions on any level. However, she also needed allopathic treatment for sure. And that was in a little clinic in the rural area, and ultimately the services she needed were scans and then hospice care, not even hospitalization. She ended up dying from her menstrual cycle when her platelet count reached 12. And it was an extraordinary thing, but that is the kind of challenge that this, very dear person suffered. From no access for a couple of years, didn't go see anyone, and that's what we saw in the very rural settings of Hawaii. So as we improve what we do outside of kind of the epicenter of healthcare, where within a couple miles of us right here, you have so many extra facilities and providers and specialists, that's what the guys in the countryside see. And so I wanted to share that because that's got to be one of our areas of focus all the time. So these are investments that help us on the neighbor islands. And then we decided we should have a global approach, because in my world, I don't want to necessarily just tilt at windmills. I want to also come up with practical solutions that people on any part of the political spectrum can embrace, so that we set a model, an example for others to possibly follow. So we put our heads together right after the election and decided we would find a way to get providers into Hawaii at any cost in a way that didn't alienate anyone. And that is what ultimately became the HELP program. We've referred to it with many names before: the Hawaii Health Service, the Hawaii Health Corps, but also now HELP. And that's Hawaii Healthcare Education Loan Repayment Program, HELP. What we felt was, we know that we need to work on reimbursements, and we know that we have to work on facilities, and we know that some people will favor medical malpractice reform and protections, and other people will favor global payment systems. Everyone will have an idea, but if we put enough providers into the community and we get a commitment from them to care for those who are on Medicaid or Medicare, which in our state is a huge number. Remember, we have 1.4 million citizens. We have 465,000 people on Medicaid, plus or minus every day of the year. So a third of our people, up from a sixth before the pandemic. So a third of our people need support. They need health care. It's in our interest as a state to care for them. It's very much in our interest to pay providers and hospitals well to care for our loved ones, because if they don't, we see people like we did in my clinic with very advanced disease, with no chance at survival, and often with super large cost and bankruptcy if they do get care. So this is what we did. We got a pretty big appropriation. We were historically about $250,000 a year to repay loans. I bumped it to $30 million, which was not insignificant. In fact, last night I had a gathering at Washington Place with 100 or so people, and one of the women there is right now doing her pediatric psychiatry training, and I found out that she received one of the HELP grants, and she's dating this really great Punahou engineer. She herself went to public school here, and she's going to have her loans forgiven and commit now. She was thinking in her mind she would not be able to come back home and be at home. She grew up, like I said, here. Now she will be a forever provider for us in pediatric psychiatry, one of the very needs that we see reflected in these statistics, but now solvable. So that's great. So there are 585 stories just like that woman's story. It ranges from people who are healthcare navigators, social workers, up to surgeons. I threw out with our team the idea that you should only stick to one part of the discipline, because I figured, you know what, sometimes a surgeon in Hawaii is a primary care provider, and sometimes a social worker is every bit as valuable as that surgeon. You just never know on any given day. So we're going to repay everyone's loans back. And so that first 585 started. In July, August, the second cohort will go, and thank goodness that the economy and our budget has not crashed, because I intend to keep this going year over year over year, so that over the course of, say, this 4-year period, and perhaps a little longer, we will get healthcare and providers to absolutely everybody in our state. And one reason that society, the community, accepts this program very favorably is because, though there is sometimes a misconception that all healthcare providers are wealthy, and certainly that's not the case for any number of people working in social work or psychology and other disciplines. They're not going to be very wealthy anyway, and it's also not the case for many physicians, of course. This does provide care for a huge part of our state. Just this first cohort, we believe, will touch 750,000 of our citizens out of the 1.4 million. And that number may reach 1 million by the time we get through this summer. 1 million out of our 1.4 million people may avail themselves of care from people that have somehow gotten loan forgiveness. So we're going to keep pressing that, but that won't be enough. Because as we deal with the social health considerations, and that's other things like wages, which are rising, housing is going to still loom large. And so we have to, for all of our people who care, especially for those on Medicaid, we have to find a way to get them housing and reduce their cost of living. I can tell you this, I've been, as we head towards the State of the State address in just 2 weeks, I've been really looking in a deep dive at what people are worried about. And I will give you a little preliminary teaser. Vast majorities of our people are worried most about cost of living. Now, it's, of course, everyone's saying that's a no-brainer, but I'm talking about a big difference as opposed to all the other issues we could come up with, ranging from environmental concerns, even to housing. Cost of living surges way beyond that, though that's a subset of our challenge. So we've pretty well got a grip on what we should do at the core of healthcare, but all those other challenges that help people be healthy and have opportunity and not have mental health care crises because of their poverty or because of just desperation, that's what's going to be at the core of how I govern. So we are going to work forward on all those issues, but we're going to continue our focus for our healthcare providers. We'll license professionals in a more streamlined way. Excellent meetings with some of our top folks here today, just 2 days ago, to work on that. And count on me to kind of broach the peace, because I know that some of these things can be a little controversial, but know that we're all moving together. Where I can't help some group get exactly what they want, I will help them in another way, whether it's through extra reimbursements or loan forgiveness or housing. We're going to accept applications from all across the country for our healthcare providers, but we're going to focus on our local kids first. And if anyone has any connections with local people, whether they were in high school here or college here or medical school here or social work training here, or maybe they relocated away from the islands, if they know Hawaii, we want to steal them from Texas and Florida. This is what the HELP program looks like, just so you can entice them in a good way. $50,000 per professional per year at the top, and depending on what other allied professions people are, based on their loan profile, you can see $25,000 or $12.5 thousand per year. And special shout out to Kelly Withy and some of my team who decided to reach into residency programs and begin the program there, because we're getting commitments from our up-and-coming healthcare providers before they even make that final decision on where to practice. So lots of good thought, lots of it emanated from these rooms. So when people ask themselves, is it worth coming to the conference? It is. It really helps me, it helps our team focus on the challenges and kind of re-up our consideration of what we should focus on going forward. We'll share this with everybody. Of course, our slides are totally available. Unlike other documents, you will not have to ask for UEPA requests from me and my administration. This is very available at all times. And we just want people to see these things. We want to see what we're focusing on. There are other programs too, in addition to loan forgiveness, because health is a larger question for me and the family. But these are some other things that you'll hear about. vision screening for all our kids at DOE. Why? Because if they have glasses, they do better in school, they don't end up on poverty, and their health indicators are better for this room. And it's just a small investment, big return. Early intervention on behavioral health challenges. It's a really huge issue for us, and that's why we're focusing on behavioral health at the crux of our HELP program. There you can see what was recommended by many of the leaders on my team. Behavioral health, more money for psychiatry, inpatient services. The behavioral health challenges still abound. The Hawaii State Hospital is going to have to continue to expand its capacity because there are just a lot of people that went through very tough times during the pandemic. We will support all of our hospitals, though, as they deliver that care, and there has to be resources. So, again, I'm grateful to the Council on Revenues to give us these dollars. This is the way we're approaching it. It's a lot of numbers, but it's these systemic inequities that still keep me up at night. The pictures you see right here are a kauhale, the first healthcare kauhale that we founded, and we'll be doing many of these in the coming months and years. This was right outside my house, outside Queens, across from Department of Health in this first iteration. We put money into that facility and we kept people from having rehospitalizations. And we had a nurse available for them and social work. And it wasn't just those 10 to 12 beds that people came out of the elements and lived in. There were another 80 to 100 people day in and day out that would come and get healthcare assessments, quick checks, showers, and the like. And that is also healthcare. And that's how we're approaching it in our government. I talked about this stuff for so many years. And so I'm grateful to get to finally try it. And if I'm not mistaken, it's going to absolutely knock people's socks off when they see how healthy our state can be and how much we can decrease suffering and trauma. We did a couple other not so small things. We protected women's reproductive rights right out of the gate because that was an effed up situation nationally. Yes. So I think there's a lot of women in that picture, and some gentlemen too who fought for the bills. But I'm particularly appreciative of the women leaders in our healthcare team. Annie comes to mind, but others at the legislative level also who've been fighting on this issue for a long time. So thank you. But making sure that it's not a political question for me, it's a healthcare question. People should decide what they want to do on a healthcare front when they're quietly in with their doctor, and he or she should help them through whatever challenges they have. And that's the kind of state I want us to be in. So we're working on that. We're working on pretty much everything under the sun. But I will just kind of wrap up and take some questions by saying this. What we do in Hawaii, what this room produces as far as ideas go, will send giant ripple effects across the sea, to the mainland, to other countries. There's no reason at all that Hawaii can't actually become the state that cares for everyone, whether people are living here, visiting here, finding a new home. This is the way that our country can begin to pull itself together. We can have, a process to heal America through what we do here in this amazing state. And I depend on you to help me do it day in and day out. Aloha. I don't know who runs the show from here, but I promise to take questions if that was something people wanted to do. I've spent so much time with like 80% of you. I've probably bored you to death over the years. But now I'm free to tell jokes about Governor Ige and other people, so.
If anybody has any questions.
Not a really question, Governor, but I just wanted to suggest that I think it's going to take 8 years to get this whole job done.
I hope so. Okay. Thank you.
Good morning, Governor.
Morning.
let's talk Kauhale. The sustainability, the financial, the data, and what that vision really is so that everybody statewide can understand that.
Thank you very much, Leah. So Kauhale, the word that we use if someone is not, maybe someone's visiting today, it's a village is really the best definition we can have to care for those who have been housing unstable. And we started small. We already have a few good examples of Kauhale that are up and running, and they range in structure from Waimanalo, very beautiful, simple houses to provide respite from the elements, to much more formalized houses like in Kaleloa. And we now have a list, and I'm particularly happy. We've had a terrific director for a year. That was James Koshiba, who, as he returns to the private sector, I get to pull my old friend John Mizuno into the team, who has a deep understanding of the legislature and what we're about. Having Kauhale villages all across the state with a very clear goal of decreasing by 50% those who are living in an unsheltered, homeless state over 4 years that we start with. Thank you, Jack. That will do many things. First and foremost, a person who is on the street unsheltered loses, as you've heard me say maybe before, 3 decades of life. They go from what is our average lifespan here, essentially 83, down to 53. Because they don't get any care, they're self-harm, they're 10 times more likely to be hit and killed by a car, and every other challenge in between. Worst, of course, for younger women on the streets where the sex assault rates are unreal. So that, plus the challenges that exist with substance abuse for pretty much everyone who has to self-medicate on some level, are catastrophic. The costs are here, over 80 grand per person per year. They drop 73% when we have a roof over someone's head. The lifespan down at 53 years goes up back almost to baseline. Of course, we don't have longitudinal studies yet, but we see the spectrum of people living, getting treatment. We had one woman go into Kauhale that actually had ovarian cancer, and she got treatment and lived for 4 years, which she was probably going to die in 6 months on the street. So this is what we're going to do. And the return on our human investment and financial investment is gigantic. We do have about $60 million set aside to build this large number of Kauhale. And what will happen is next we open it up to the community. So we do the formal ones that have a little more structure, more social work, more nursing, visiting providers, to community Kauhale, where a church or a nonprofit says, we'd just like to have 8 units or 12 units. We can handle the social support if you can handle perhaps the cost of the water and maybe a little bit of food support, but just deliver the units, and we'll do that too. And so this way, instead of having hundreds and hundreds of millions of dollars out of our budget go to an individual who has to go to HPH or Queens or HHSC 30 times a year, 50 times a year. One guy went 241 times in a year, a guy named Gary. 241 times to the hospital in a year, $1.2 million of spend for basically nothing. I mean, he was a little nutty, but he did not have major health problems. But that is not the way the healthcare system should work. And so Kauhale will do that. It is important that we show the true analytics on it, though, because when we ask my friends in the reddish states, they like me to show the ROI a little more. And my far left friends, I think I went the wrong direction there, who believe housing is a human right, they like to see the number of days that people stay and the retention rate, which is over 80%. So these are the kind of solutions that I really think are part of our healthcare system. And if we flash forward 5, 6, 7 years, what instead of actually buying the units, which are about, say, between $14,000 and $18,000 per tiny home, not a lot. Instead of buying those units, we'll just be repairing them and doing the social service contracts as a part of the health system at a much, much lower cost than what we traditionally wrestle with in the hospitals. So that's part of our hopeful social agenda, and I can't imagine it will really upset anybody. So I'm lucky enough to share that with other governors, and you're going to start seeing, if you haven't seen them already, some pretty decent changes on the street. It's not perfect, I know, and some people will be resistant. I admit that, but for these kind of changes, changing the way we view homeless health, changing the way we view access to behavioral health a little bit is going to really, again, put us far ahead.
We have time for one more quick question.
Good morning, Governor. This is Francis Chan from Hawaii Health Information Exchange. I just want to make a comment, and I really want to thank you for your leadership in advancing all the initiatives that you described and the Health State 2025 plan. And I think that gives the focal point for the community to rally around, and I really look forward to your next State of State speech and give us more items that we can rally around and advance your agenda. Thank you.
Thank you, brother. Well, that's very flattering, but I'll tell you that there's no way on earth the agenda got formed without first the group of healthcare leaders that drove me forward all these years, and now the housing leaders, and I intend to deliver on these necessary changes that we all kind of hoped for so long. So thank you for staying in healthcare. Thank you for committing yourselves to help our people's lives get better. And you know, we have ups and downs, no doubt. We have great days and we have tragic days, but the work that you do is making hundreds of thousands of people's lives better in Hawaii. And frankly, it's creating a housing problem for me because everyone wants to move here. So thank you guys for giving us that challenge, and I'll always be there for you. Aloha.